Abusuafo michasha mu nyina ahanom ye Assafuah 92.7 so na waso guso awuti ne de medical matters dwumadi no na ye de bremo ne de edem sonko kra na me fa akonya we so na yama yahwefo a omusu etie anaso omohwe wo Facebook ene YouTube yada masese mo so magibra mutie anase mohwe ye ne medical matters me amidi dwumadi ho chame which me afre me Dr. Anthony Assafuah na doctor penyini kese ba ko so abekan yensa wa hanom doctor osuade wonimde osuade akwachi na doctor edinde doctor Nabil Dekpeh oye specialist physician and cardiologist na also fellow-in-training or Confirmatory Teaching Hospital Dr. Esuade akwachi nene medical matters no ye de topic me fan say chese oti di ni kra na ohun popo na doctor wa hanu media obenya ntobo ase na wa chichi mu ne fare by de eye se wunya bia de eye manipedua no ehun sunsanso ekwan efa so ba chese doctor benya ntobo ase acheche ni ne mu amaye ene HIV/AIDS, which is human immunodeficiency virus, and or acquired immunodeficiency syndrome, which is HIV/AIDS. Na ene doctor ebenya to say actually mu nti ye shemo say mo njebre na mo ntie because ene discussion no e shonko na topic we so no e very sensitive, so ye pese ye ma ye tie for tie ase ye na omu hu enema bi e wo ho se ne be ya unhu se anaso oti so obi anya bia ekwan so bi si fafa so related to the person se ne be ya betumi di asumdu aba na nadwumadie no omo maso yase Abyss kitchen treat and also medical matters dwumadie yase na wo hwehwe Abyss kitchen treat omo wo oltafo omo ben meadows pub honoma omo wo nnuane bebre jollof rice with chicken, jollof rice with fish, jollof rice with beef, fried rice with chicken, fried rice with fish, assorted fried rice, assorted jollof. Na Sunday crowd ye dem stronko omo ye Sunday special enkwan aduane bi apeso di bi akokọ no ma obenya bi Abyss kitchen treat ewo meadows pub in chen honoma omo bie 10 am to 12 am omo honom mre bi abeko bia omo ho na apese omo ye order so ma wedding funeral outdooring ni nyina omo ye obetumi afre omo 0242 02 7009 0242 02 7009 Abyss kitchen treat polynatural mineral water we didi awie no obi hia say obenu nsuo polynatural mineral water so ho no ma nsu krojira ono ma unya haw bia polynatural mineral water so asodwumedi yase omo ekikwan no ewo Pankrono Estate Kumase obetumi afre mpanyinfo so 0247 113473 so person of funny bibiri so akonya wo ho obetumi afre mpanyinfo na ono omo atwetwe nkomo Tafo Pankrono Cooperative Development Society eso so edwuma kru bi a omo abatafo hanoma se o pe besia bi de akoye we o pe besia bi e de aye dwumadie bi ekwan wo honom obetumi afre Tafo Pankrono Cooperative Development Society ewo ahomatufo yi so 0243 713 035 na omo pe mobile bankers nti se wo pe adwuma so aya obetumi afre omo na wakuhu mpemfo na nhyehyeye ho no omo ne waye na watumi ahye adwuma ase omo number nam sade to twa no 0243 713 035 obetumi afre omo na watumi na omo se minimum qualification kra no as a mobile banker no say we SHS into we SHS na say bibi ni untumi nto aso na ope bibi kakra ye na odi abobo sika no ato aso obitumi ehun panyimfo na otumi ahye adwuma ase ewo Tafo Pankrono Cooperative Development Society na omochi kwan de enye ya kwan ko mo Tafo hanom ya omo ne Assafuah radio hanom na ewo the same building nti wo ba obi hu omo obi hu omo na Dr. Nabil Dekpeh ewo ahanom se na medi kan no oye physician specialist and also in cardiology na we soon dey akwa say fellow-in-training ewo Konfanoche teaching hospital. Doctor memo akwa ababa dwumedi so
yo yemia
yeah
yes sir okay me that's papa
akwa ababiem so
yo thank you very much
yeah nene yeti for agebro omutie say ye de medical matters dwumedi bebro mo say na medi kan nene topic na very sensitive HIV AIDS, which is human immunodeficiency virus and acquired immunodeficiency syndrome. Yeah. Inti means emre no. Meja aka se munama na de wo bia no wo de amaye. You can HIV cry there.
Okay, yo me that's papa na madam was any opportunity amudi amaye.
That's right.
First no, I mean rectify BB kakra.
Okay.
Me a physician specialist. Now me a cardiology fellow-in-training.
Cardiology fellow-in-training.
I'm not yet a cardiologist.
Oh, okay.
Yes, I'm a professor.
Matthias.
Okay. Hopefully very soon I'll be a cardiologist.
Fantastic. Wow.
Thank you. And HIV there, in fact, subject I discussing enumerate a very, very important subject area.
That's right.
Now HIV area sebi yebeka se obi eni ho a obeka se onti HIV hu da. Obia wo some idea about HIV there. But your misconceptions bebre about yare no a ewo out there in the community. And important say you benya opportunity at discusses our subject area way so that's that you betimi I make sure say information and confirm one no the correct information. And yen confirm so on betimia she send on bebo omo ho ban. And HIV you can HIV there. HIV and kasa a short form of a full name.
That's right.
A human immunodeficiency virus. And you know HIV no. Discussion no you per se as simple as possible so that not too technical la obi abetimi afolo. And HIV there yare bia affect nipa moja. Well yare bebre wo ho yare a your friend generally yare bia wo ho bia you were two ways of categorizing it. And yare bia your friend it's either a communicable and a non-communicable. As any trace yarea ebetime movie from one person to another.
That's right.
And yarea entime move from nipa echo another person. Sebi so obi wo BP yarea high blood pressure moderate so entime movie from obi echo another person. And no your friend non-communicable disease. Now HIV there yarea bia etime movie from one person to another and a communicable disease. And that will be the start. HIV yare affect nipa moja and a communicable to say yare to say malaria, cholera in your mani now or more communicable diseases, meaning that a team move from one person to the other. To the other, exactly.
That's right.
Okay. Now, I did bakwa very interesting about HIV yare. Hard dream bebre in yama mienu. Now, one is that there's no cure. HIV yarenu there's no cure. As any tracer, ye need a draw ebe two yarenu once and for all. As of now, the HIV there's no cure. Ejuma bebre kosu ashe sena ye betimanya cure for HIV, but for now there's no cure at all. And that's one thing a trace yema etie for etiase but ye wo indro bebrea ewo ho etimi suppressive virus no se unya yare no a ubetimi live normal life. Several years ago no unya HIV a death sentence because now you need a drokra ye de bema wa ebeboa. Enti obi a obenya HIV bia a death sentence. But say you will draw bebre wo ho a etimi control the virus no. But one of the important things a chest a yama etifuti say ye ni cure wo ho enti obi catch us say oh a draw way wo ho bibi draw bi wo ho a draw bi a ebe tu yare na say oboa. There's no cure. Now there's a lot of research any
research
hopefully in the coming years no we can get a cure.
That's good.
And I think the
inti answer na doctor ebe to aso no me pese me dey your number ne to dwa na discussion no say na doctor di kan ya no we are discussing about and I say can about HIV/AIDS ti ye pese ye to ibo ase na chichim na ye ti for eti ase yi dwumadi ne koso na ye bebie phone line atum na obi so and I say ye ti for no obi wo question and I say contribution bi ono so betumi afre no de ama your number no is 053 977 3411 053 977 3411 na me sa so aka mo say this month December HIV awareness month intina ya jebra ya discuss about this topic na sana ya beto aso no me pese Dr. Mai something called epidemiology kakra efa HIV no minim kra de minim say HIV no obi kra be bisa say HIV no free him fa ne bae de kra de ene ye betena ye na nhwehwemu ama ati ase say in the year 1981 ena ye document say HIV yare no ewo ho na nhwehwemu so kire say the year 1959 ena you see a free Democratic Republic of Congo bae economy na omo realize say yare ni bi wo but ye document ya na nkasa de 1981 na omo fa say a free primate mo which is zoonotic animals and as a zoonotic infection mu and a free e bae chimpanzee mu ene mo akakra akika ho but omo hu say aboa no or chimpanzee ni mo a it doesn't cause any infection na omo susu say chimpanzee ni bi ene hunters no hunters kra be kanu twi no obofo twi vala obofo esa interactions no de ekọ so nti omo fa ne say free chimpanzees ni bi na hunters no ebi eso edi coffee na I think say spread there but aboa na nkasa no HIV virus no or chimpanzee ni ma they don't do any harm to the chimpanzee itself nti hono na me fan say if you much say free buy and I were two categories I think say two categories HIV1 HIV2 nti doctor be to me actually more hono ma me atia say nti pese ka epidemiology no ho kakra ne how HIV is even affecting the world now.
Okay. Yo, thank you. And yes, exactly. Sena Okaino, you were HIV1 and 2.
That's right.
Now, HIV1 worldwide, the most common. Say, HIV1 and 2 are HIV virus. No, there are some minor differences. Emma, you can't baku say baku ye 1 and a baku ye 2, but they are very similar. They are very similar. Now, HIV1, the most common worldwide. HIV2, no. We are seeing in West Africa pana utimi hu HIV2 and HIV2 so the rest of the world but more concentrated in West Africa. And it is West African countries, Ghana, Togo, Benin, Nigeria, Sierra Leone, countries are more
Sub-Sahara
West Africa. Omo habo HIV2 no. But worldwide in HIV, even in Ghana, HIV1 is still the most common. So even among West Africa, the most common HIV1.
That's right.
But you a lot more HIV2 in West Africa compared to other regions of the world. Now, Sena Okaino, HIV yarenu they affecting every corner of the world. As of 2024, say now over 40 million people yarenu a omunum huedro.
Just last year, started by
yes, as of 2024, over 40 million. 40 million, minim sena ubekanu ewo chimu. But over 40 million.
40 million.
Yes, over 40 million people.
Wow.
were living with the disease. This year, yenya statistics for end of 2025 year.
That's right.
But most likely, no numbers no
increasing. Yeah, they be increasing. Definitely.
And the sad thing to say, majority of 40 million or more Africa, sub-Saharan Africa, and over 65% of 40 million in Kofi or more sub-Saharan Africa. So, usher worldwide countries are or more highest number of HIV. Top 10 ni now Africa. Top 10 South Africa, those Southern African countries Zimbabwe, Mozambique, Nigeria, they occupy the top 10 places. Say countries are or more highest numbers of HIV worldwide. And they are very very serious. Ghana say as of 2024 no. Now there were over 300,000. In fact, about 334,000 plus in Kofor or more HIV area or Mutina Ghana. 334,000.
Wow.
Yes, as of 2024, 334,000.
Regional basis, we don't have that stat as at now, right?
No, and see, regional basis, no, you say these numbers, no, the top 4 regions are contributed to these numbers. Greater Accra, near Ashanti, Eastern, any Western region. And Greater Accra, is number 1. Ashanti region, is number 2. Eastern, number 3. Any Western region. And these regions no account for majority of the numbers. Over 70% of the numbers are coming from these regions. Oko northern regions say, numbers no they account for less than 2%. But majority of cases no Greater Accra, Ashanti, Eastern, any Western. And the Ashanti region is a very high risk area. Baby, you want control baby or more HIV or more Ashanti region. Yes. And from statistics as of 2024 no, every day unya about 50 people are omunya HIV infection
every day
we have about in Ghana. Yes.
Wow.
In Ghana and worldwide with Ghana 50,
here.
Yes, 50 people. Yes, every day.
Into almost 50 people is it accidental findings and answer or man kasa base or mu na hospital and I say doctor no I lab investigations and more. Okay. And I say accidental findings.
Unfortunately, most of in Kofra who are more HIV. Do no moba any yare. Or moba any yare. Yen drew baby. So once now umbe hu nkofobia or mobe ba hospital so umba be checki status, but most of them bibinti ebia wenya yare bi ne ho mfa na waba hospital na ya test. But ushe numbers are yenya for 2024 in terms of inkofufu fra omwanya yare no between 15 to 18,000 as of 2024, and it tells us that every day bia approximately say inkofu 50 enya infection no.
Wow.
And you na ombeba hospital ye betimi home, but in terms of your projection every day be about 50 people enya infection. Yes, wow. in Ghana.
Inti answer na Dr. Betwaso no, because you see no I was say you can about say the kwan ye fa so nya infection no, but me pese dey number no say to dwa bim na ye tie for etumi pick number no so bi wo honom na so ofre na wo bisa question na contribution na doctor yi aka ho asem kakra nti number no 053 977 3411 053 977 3411 ye nyam bi entumu ye bibia atum na ye tie for so afre also o question bi a obetumi leave no comment section ye be ready na ye here no nti doctor na o say ye projection no say at least 50 people enya HIV infection ye be a day, yes. Na so how do we even investigate these people? And I said how do we find out? So let's zoom into me find said some of the signs and symptoms, and I say
okay, very good. Now ansana yebe ko sa area no. There were two things and come per se mima etie for etia say one ade american earlier say HIV there's no cure. But you were in draw ewo ho a ebetimi aboa nkrofo so omunya yare no enti ye encouraging nkrofo say omumbra hospital ma obi an deceive obi say no medro way no insure way ebeboa omu waste time any usika. And the second thing that important about HIV ni say wo ye nipa dwemu no ye wo system bi a fight off infection.
That's right.
Ti say obi nya malaria say ya your body no ankasa nyame up the soldiers be atu your body mu sa soldiers no your friend no immune system na sa soldiers no say yare bi every immune system no a every your body no mu a sa immune system no na soldiers no ebe fight infection no enti say obi anya infection bia ebia pneumonia malaria jinsomu infection no your soldiers and our immune system your body mu a fight off infection no.
That's right.
But adia HIV they say era umua destroys our immune system no. And that is one unique and a special thing about HIV and yare bebre na sa HIV yare no era umua attack baby o sa soldiers no immune system no na attack
the patch of a virus net to some very good virus net that's no ope say o join here or Facebook YouTube I'll be to me so I join the pictures no e da ho no who dey we mo ano etie.
Okay. Enti se era your system no more affect immune system enti weaken u soldiers a nyame dia to body a be fight off infection.
That's right.
Enti yes exposing the panel to all kinds of infections. Enti ube say nkofo bebre a omunya HIV ko mo now HIV destroy omo body no. Most of the time other infections na eba na finish omo because HIV no a weakening immune system no ema soldiers are fight off other infections no omo very weak. And yes you become open yes unya malaria kra malaria sabi obia timinya bia ne ho beton after 2 exactly after 2 unya de no e be very severe. Exactly. Yarabia obia timinya usually say one fire odrokria sa system no timi fight off ohu better no unya HIV no because it destroy immune system no ema body ye open defenseless. As a team omuni defense
go ombeshe go sa
yes ombeshe go sa
wow
kotokwa omu defense aye weak.
Wow.
You be sure musa and that's
doctor kotoko for
that's one unique thing about HIV and can per se for say one they say there's no cure but you will draw wa unuma ebetimi abo onwo ban so that you can live a normal life. The second thing you say it destroy immune system natural defense mechanism so, exactly and anything HIV is very very dangerous in terms of signs and symptoms. No, most people are more HIV or more sign bia.
That's right.
And that is the interesting thing. Majority of people are more yare way or more there's no sign or symptom. And initially no around the body more they are fine, they are okay. Omo ntre sign or symptoms ya na say yare no sha say koso weakening immune system no na omo sha say enya other infections. Enu na ebe ma omo some headache, some fever, some body pain. Ube hu say ne appetite ebe kofom, ube hu say ebia obenya rash bi egugu ne ho. Rash bi egugu ne ho ube hu se ne yem ebe sha se ehwie obenya diarrhea. Wow. Ha ye wo bibia ye friend lymphadenopathy no ube hu se some swellings bobo ne ho ni na
I think say intwi no be ka no say bibia twondoa
okay
bibi twondoa abo se honom no aye denden kakra any friend lymphadenopathy.
Yeah. Okay, thank you. Ube hu se sa nyama no ebeba ho ni enti most of the people no omu symptoms or sign bia enti kofo bebremu wo yare no omu ye okay, they are fine but say yare no that's at the early stage but say konenima hona ubehu say omu ahia say enya signs and symptoms fever ne omu be hye ube call hospital ye be ma withdraw omu be hye be call form be saba omu be hye all the time. That is one important sign. Ubehu say osu beti osu ate weight loss u didi but osu te ube hu say na rush be egugu hu unti ase because sa rush ni na because of say immune system no eni adwuma enti any infection bia etimi affect you.
That's right.
Na ube hu say uyem ebe sha say ehwie ube nya diarrhea all the time diarrhea ube hu say rush be egugu wa numu your friend oral trash rash be good. And these are the early signs and symptoms of HIV. Say economy pa dia etimi the problems be brave but early stages no adia me say at least in tier 40 as I say early stages no interest sign or symptom be early stages no most people are asymptomatic say
is there a time period obi to me ama yeti for atia say within this time period it be 3 months 2 months 6 months and sana sa ahohye any headache any oral trash now doctor ebobosi omo behu sanema is there a time period from the time and nipa no inya infection or the coping time or back stress signs and symptoms we no patcho so
okay I mean that's a very good question actually there's no specific time period because nini na depend on individual immune system no.
Okay.
Enti sabi obi wo ho a oni yare bia e wo ne ho. Oye okay bia oni diabetes, esitwe yare, oni BP, oni kidney, oni yare bia wo ne ho. HIV no kwa ana affect no. Enti ono no e be take it some time and sana the immune system no e be conform. Sometimes it can take more than 1 year, sometimes more than 2 years. Enti e possible say control bebre wo HIV no. Sometimes it may take them more than 2-3 years and sana obesha say trace symptoms. But sebi obia already owo yare bi already the immune system no enye very strong no or you likely say obesha say trace symptoms no earlier.
Okay.
But there's no duration obeka say unya yare no a within this duration no obesha say a trace symptom ni na depending on sena onipadue hu ti sena immune system no dada ebia so immune system no very stronger e be take some time eventually no e be weaken system but e be take some time compared to obia sebi owo sicheriare because sicheriare ankasa e affect immune system no and so owo sicheriare na usichre no de bia e wo so na se unya HIV on top of it definitely wonu e be take a shorter period that ube ansa na ube start ube signs and symptoms.
Wow.
But the important thing I stress you can want some about this aspect soon say so obinya HIV ene na okoye test no ene ebia on tested positive it take some time and sana the test no ebe positive
na edint na ede sa aba
okay
ebe ka ho asem ansa na doctor be isa question na no your number no 053-977-3411 053-977-3411 doctor ebi sa question na no edinti ene de sa eba because unya na say okoye test no ene ebia na wan show say wo bi but in natural sense ebia na wo bi edinti na de sa aba doctor.
Okay enti sa period no your friend window period
okay
window period a period that when you HIV infection no but we test no any positive.
Okay,
it doesn't mean say infection no any ho. But HIV test no where they are a bit technical but HIV test no antibody test,
right?
Antibody no a bibia ye anti set test ye initial test ye for HIV no sa test no and check HIV virus no ankasa e check bibia ye friend no antibody sa antibody no e bibia ye nipadue e producing response to HIV no. And sometimes we take it time and sana antibody levels no be build it up.
Okay.
Well, your tester a checky virus no ankasa and no more accurate and no a temi catch infection no much earlier.
It is a viral load no endorse on prana.
Yes, exactly. And no HIV viral DNA and no a temi catch infection no earlier, but initial test a screening test and no checking for antibodies. Now antibodies no take time and sana o system be producing antibodies. And your period that your friend window period and only about 3 months.
That's right.
And into and say ebia obi akwakoye bibia ebe exposing to HIV infection or your test no NH na ebia ma example ebia young lady bia sebi obi a rape no a rape case
rape case
na opese or check say wenya HIV and also nya HIV once a rape no occur se bi ene na within 2-3 days or call hospital or check test no a bit may say obey negative but it doesn't mean say onibi and such a case no is a bit too early and just a year repeated test no after 3 months.
Okay,
just to be sure say after window period no you better testing the biome and making sure say on your HIV infection.
Wow, fantastic. Okay, your number no me side to your beam. Ebi ana or question no person free. Now ubisa doctor. Your number is 053 977 3411. 053 977 3411. Ye be ya home atro for na tum na also what to me afre na ubisa question. Obi to me so eja o question no e wo your comment section ho. Ya hwe for mo he o Facebook any YouTube be to me eja question so ho no ye be ready atum. Yenyam be a phone line into mu, but I think say I'm out for say free. Doctor, we pass up yam pick we no, but yenyam friend to mu. Yeah, hello.
Hello, good evening.
Yes, good evening. We pass up him for now free. Who free tafo? Okay. We pass up me enter one can.
I pass
up say.
Now we with the same check up and look at many HIV and I say many any infection there.
What's part of
and my bar, Abia, Namaya man for some Monday, my bar, coconut.
Okay.
The bar now, moon say,
okay.
Mamma, Abia, there was a 3 months staff and you don't know.
Okay.
And then I should say, I'm not 3 months because men are made when you're so that's a recipe and I'm needy. And I want to turn it on a side card is also back or buy on every access.
Okay. Doctor Mpacho, what's your question?
Say okay say obe checki ne ho ena ye catch on say oni yare
oni bi
ena obisa say e be den obeba in 3 months time.
In 3 months time, yeah.
Enti sa nipa we one very good say oba hospital oba checking no enu na ye encourage say obi atimi ye e just say obi abana o checking ne ho but in 3 months time no important say you be repeat test no because assuming say ebia onya infection no last week and now 2 days ago and now 3 days ago most people no sebi onu paako no wakoye bibi one few days and sana oba obeye test no men can say your colleague yes but me a bit of scenario most people know ebia after BBAC now on the park no person or checking the status ebia businessman we took one ako Dubai no for 1 week business meeting you may be see here waba back to Ghana and he officially say oko Dubai no or share maybe and to a person checking the status. The interesting thing is initial tester obey no it's not enough. One because it's still within the window period and to be sure say when ya Arabiano a tracer or repeated test no in 3 months time. A tracer or repeated test no in 3 months time. Because with that few days no may not be enough. Exactly. And nothing a window anti-sa individual will say, oh yeah, test no. Usually nurses no omo keep records e hospital ho. O call HIV clinic bia usually ba ye bed you number, ye bed you contact details so that on betimi afrel. And he say obi say o call hospital o call test na say o ye negative. Usually on be catch us say repeat test no in 3 months time. So that you are sure say test no one year within the window period. And most centers no on be free back. Akai will say, oh, 3 months it drew, but more than the banner repeat test.
Okay. Now me say catch a for say Dr. Nabil Dekpeh now Otenen Kano or a physician specialist and cardiology fellow right in training. Yeah,
yes.
In training, yeah. Or Confirmation Teaching Hospital. Na Assafuah radio is now also good so out. Your number is 053 977 3411. Also be to me afraid, but in young friend to me for Munya Bucheka. Doctor, me patch me person ye call a choir ye first wa yinya HIV no.
Okay.
Ways of or modes of transmission, but ansana ye be ko no me pese me de omo so dwumedi yase no etu dwa kakra na omo inti your sponsors for this program Medical Matters kwan so da ho so person oba na obe sponsor your program ya kwan da ho Abis Kitchen Treat and also dwumedi yase de bro omo utafo Meadows Park nchen honom na Abis Kitchen Treat ye de bro polynatural mineral water open so I muda ho ye crogin anoma polynatural mineral water na make for the amount omo ewo Pankrono Estate obetumi afre omo ewo 0247 113473 omo ni achi omo Pankrono Estate hey obetumi afre omo na also watumi do super na waton Tafo Pankrono Cooperative Development Society eso ye adwuma kru bi a omo ene waterfo ha no me ya se ope business bi dia ye we ope business bi dia ye business kakra ope business bi dia I mean ope ska e dia ye bibia obetumi aba ho akonya wo honom obetumi abehu omo na ne mpanyimfo di nkomo na omo so etumi aboa dwumedi bi a wudi bia Tafo Pankrono Cooperative Development Society omo tafo he ya na obetumi afre mpanyimfo e 0243 713 035 0243 713 omo epe mobile bankers inti minimum qualifications we SS na say bibinti munye scan to aso na opa adwuma kakra ya obetumi abehu omo na onim payfo di nkomo na nhihye bi e wo honom no also wodi so na waye na otumi ne omo aye adwuma I think so omo pay no so very good doctor ya sa kwa baby
okay
na sa window period ya o kan ho asemi question na ye friend ni friend na obisa no I hope say wanya answer to his question. Inti sa window period no ye test wa bibia ni wo ye hu say we positive. So 3 months time na wasa so ye dey back na wakoye me de me kan say wo say wonya na wutiri mu ntene say bibia ni honom na wo so watumi abobra na watumi aye.
Exactly.
Na yenko modes of transmission.
Okay.
Because you can say we nya HIV e kwan be so no be fa so omunya
HIV. Okay, very good. Enti HIV no sana ye shase kai no eye moja yare. Enti the mode of transmission any say ebia moja ni obi moja ebe mixi ana hunam nsuo any obi hunam nsuo ebe mixi me pese me breaking it down na obi ati me say
brafom na eti
moja ni moja ebe mixi ana hunam nsuo ni obi hunam nsuo ebe mixi enti sabi say ebia wako hospital na say ye ma moja na ebia moja no HIV virus no wom definitely ubenya HIV infection because sa nipa moja no akọ moja mu inside
wow
ha enti enu na ye trust say moja ni obi moja ebe mixia that is one example.
That's through blood transfusion.
Blood transfusions, exactly right. But it's not the most common and the most common means of transmission. Me as an example now will be ATS here. Say ka umoja hunsio ana say ye hunam hunsio. Ti say sebi obema ni oba Asia. Well, so obema ni oba Asia. During sexual activities no omu insio mixi obema no or release ni semen or release bibia insio every ni mu eko obani mu inside na obani mu obanu so secretions are every na say honum so bema no ne honam eba into contact with SARS secretions no.
That's right.
And sexual activity is the major means by which HIV is spread. That's the most common means that HIV is spread. Sexual activity. She said obemani obabeshia. Now sexual activity ni him say these days enye imema ni mankwa yewo imema ni imema omuda omusushia yewo imani ma omusushia and any form of sexual activity whether vaginal or anal, in fact we even see say imema omuni memeshia infection rates no much higher amongst them compared to sabi imema omuni imaishia. And who say imema omuni imema edano HIV infection more common amongst them than ufa in mema or mumfa in mema either. Men's sleepy ana gay, you fan say gay.
Gay, you can't was in
gay, exactly. LGBTQ for exactly. And in mema or muye gay, no.
Yeah.
HIV infection more common amongst gay men than in mema or muye gay. Far more common amongst gay men than in mema or muye gay, because one sena yarenu team spreading no say only oba Asia na say oba no ni hunsuo definitely no ni hunsuo ebe tachi ohuna, because
definitely
oni padua call oba ni inside.
That's right.
And he definitely say uwo cat uwo baby kakra etwa wo ubema ho eba into contact with oba ni hunsuo no virus no ewo oba ni hunsuo no mu entina aura umu. I hope say my explanation is clear.
Oh yeah, clear. I am more question me person me bisa wo intina.
Okay.
Me also meeting we here nefa.
Okay. And one of the first means yarenu spreading sexual activity.
Sexual activity, that's right.
But sex no ye ka say ye wo emma embema omudi mada. That's what we are all used to. Normal. And ye wo emma omudi emma da. Now omuno they are among the very high risk population now, because HIV infection is far more common amongst gay men compared to imema or munyegi. And I hear what imma or muni imma suda. Lesbians, exactly. Omunso infection cause anti-sexual activity the most common means are HIV yarenu spreading. The other means are spreading omu use IV drug users.
IV drug users.
Exactly. Omu panye. Tramadol ni petidin ni impanye bebre, because obemu se on pakuno wo ni ho a the same injection no the same panye no enu na odebema ni colleague onu so awo. Enti by that means no se on pakuno ena panye no so era ni mojamu. Enti se on pakuno wo yare bia ebia HIV no HIV virus no is still on the needle. Now the next person use needs the same needle dia one who. And IV drug user another major means that yarenu team spread it, because almost you see the same needle and needles no so almost sterilizing needle no almost paper needle no ono anu say obia wo and the other means are team spread and no and is sabi oba or kowo and say oba one nima or yarenu so num ne dra yarenu team spread from oba no akoniba during childbirth, another time our man would breast milk no and you know a friend mother to child transmission. And sometimes some of our cultural practices are in yama ewo your culture mu. Sometimes we say in some cultures no omu chicha in kolani blades nyama omu tribal marks, all kinds of cuts, and sometimes these blades any sharp objects omu use no omu nye clean, and say obi wo yare bia it mis spread ako most of the children or individuals are involved in these activities.
That's right.
And make a blood transfusion also. Yes. So these are some of the most common, but the important means I trust say sexual activity, drug users, mother to child transmission, and in control almost share sharp objects, needles, any sign.
So now yen check ye tie for asika crown said stigmatization doors. So we who say bia ni nua bi anase na busuani bi kra wo HIV na omu nyina tifim baako the way omu betete omu ho akire ni pakro no psychologically no ebema ni pakro no kra ewu ntem, but nyenye HIV ni kra ni cool no, but I mean that depression na ni pakro no go through no eno no kra betumi ama ni pakro no wunti yema ye tie for nti asese efie no enema obi wo HIV a omu use kra na so use bia unya bi no sene be ya omo betumi ayede ate ase no betumi ne omo wo bi no betumi atena kama e wo fie. Yes,
very important, because say ti ase sena yare no timi spread ya na yenim sena yedi omo betina and anti HIV yare and spread it through a journey. and spread it through aduane and spread it through nsuo. Enti only obia when you HIV mo betimi edidi. Yes, you can eat from one bowl and HIV is and spread it through aduane. Because ebia obi wo HIV odidi a na aduane no udi the same aduane na obenya HIV dey be and spread it through aduane and spread it through nsuo. Ade a ye encouraging you say ma yenye bibia ebefa ye hunam nsuo ebe mixe. Ti say sabi on pakunu or shaving stick or the shaving ho. Shaving stick no definitely timi twa no kakra. Na won so wakwa kofa the shaving stick e dia shaving
the blade odi bubu ne nine.
Blade odi bubu ne nine. Exactly. Obudi bubu ni sa shaving stick o use. Bon, e bia the sponge or the jari and trust and mutimi share the same sponge. Toothbrush,
yeah.
Because sanyama no bind into contact with our body fluids.
That's right.
But and yes say ono pakono muntumi da impa bakoso muntumi entina ekondua bakoso muntumi didi David HIV doesn't spread through that means. And through contact and at home no there's no problem say you be interacting ni inconform with HIV because in fact your name say it's very common. A lot of people ever HIV or moninam your community. Exactly. In fact, say Uba HIV clinic, ewo Komfanochi ana Kolebu. Ube who said most people are mobile clinic or mobile beji drone. There's nothing ube who ewo mu a etrese omu yari omu HIV And the important thing is say TS here send a yari no spread ya you bet me abo your ban. You bet me abo your ban. But there's no problem say uni obi ewo HIV mubenya handshake, shaky hands. They be arenu and spread it through handshake. And spread it say ube hagi on the pakunu and spread it say mube tenacity on the same chair as TV. But I encouraging you say avoid the using of objects bind to contact with your blood and your body fluids.
Even kissing.
Yes, even kissing. Kissing definitely you can get the obetimianya infection through kissing.
Okay. Answer na Dr. Sabe twaso no me de ya homa trofo na etudwa afide ye bia tum ye tiefo betumi afre 0539773411 0539773411 ta afide ye tiefo betumi afre na ya peke wo call na wo question bia wo bisa na Dr. Eyu ano. Okay. Hello. Me pacho baby I can say free. Bremine. Okay, me pacho eat you.
Pacho Doctor say. Yeah, me say na the matter say HIV is spread through blood.
Yes.
After we be kisi and after there only oba have sexual intercourse.
Yeah.
Na the man in cat or the man where the food will be contacted. Obetumenya is media.
Dr. Pacho, what's your question?
My question.
Okay. Dr. Be you and Pacho be to me here for my.
Okay, yeah, that's it. And you are right on point. And say only spread through blood. And say only oba share. Like I explained earlier, either blood and ye nipa due munsio. And I dear friend say body fluids. Exactly, bodily fluids. And say only oba share obanu. Insio bebre every nase normally. And he said obema mu se cat kakra wo obema mu wo obema mu na se bind to contact with obanu body fluids you can get the infection. Kissing so the same thing. Most of the time no ye bebre no ye wo cats kitten
oh ye no
exactly. And most of these cats they are so tiny Philippine bia. In fact, most of the time say brush when you crab when say moja kakraba. And sometimes no you have small cat centers in the mouth. And he say only obi awo HIV case here possible say virus no e betimi around because of body fluids mobile exchange in the process of the kissing.
Now, doctor, so answer no will be a HIV ebema will be say virus no ye wo viral load bi o hono ma ebia na endorse ebi on so na kakra bi eno no sa no still na nipa ko no betumi dia money the other person na taking into consideration virus no do.
Okay, and yes, the viral load no say viral loader sometimes obi wo HIV a yetimi check HIV mo ano dudu osan e wo on pako ni system no eno na ye kan no say viral load. And say obi a say be viral load here 1 million for example, it means that sound pako no or more viruses than obi and viral load 10,000. And say viral load here 1 million na more likely say ubetimi transmit infection oh yes say because HIV infection no a lot of viruses etimi transmit once a viral load no detectable no the risk is there. But anything na indro no adia indro no ye ni say ebema virus no be confirm ebe suppressive virus no ye wo indro bi wo ho a they are so effective cra say viral load no etimi ko undetectable levels.
Wow.
Yes, and it doesn't mean a virus nako, but in drone are so powerful, so it means suppressive virus to the extent that viral load are undetectable. And that is the target. Pese obia onum HIV arabia pese viral load no echo undetectable levels. But it takes a bit of time and sana ubetimi achieve sa level no. And so viral load are very high no. You are likely say ubetimi transmitting infection compared to be an viral load low. And for example, oba one nima or yare no. So onum nedro a drone be suppressive virus no. So that the viral load be confirm. And don't say a drone a 2 yare na say, but the viral load a confirm a prevent or be transmitting infection no exactly because say ye who in collab mothers HIV ya wo na akola no so anya HIV very sad but ye who bebre so because of a draw num no nkola no are born and they are clean. Yes, and the nkola no are very clean because mami no for the time onya anisa no one no draw no infected enti ye who bebre enti ye be encourage anything na appeal for se onya nyinsa a hospital one of the tests exactly
very important ENC clinic.
Very important, yes.
Wow. That's the doctor. Your number is 053-977-3411. 053-977-3411. This will be to me afraid. That will be our question. Doctor, now, young your time no. So let's talk about some complications. The kind of if you and I'll touch a little bit on that.
Okay.
Now let's talk about the complications now.
Okay. And ebia ansana ye beba honum no ye pese ye ka sena ye bebo ye hu ban from HIV and once ya tia say sena yare no is transmitted no we all we have to do is to break those barriers of transmission. Well, it is as simple as that.
That's right.
And the most major means of transmission is sexual activity. And anything I encourage you say, encourage use condom, especially say unim say untimi and stick it to one sexual partner. Uye obia, maybe you sleep around a lot. You insist on using the condom because condom no a prevents our contact on the barrier exactly. A prevents our contactor unam ebenya ni the other person unam use you exactly. A prevents our contact until condom use. A very important means you be prevent HIV. And uko some countries, some jurisdictions uko every hotel be a omuma condom for free.
Yes, that's right.
Me say recently some of our authorities teach condoms.
Yeah.
And Obibeka say encourage sexual activity. But the truth and he said they are having the sex. Oh, exactly. Yes, and that is the truth. Yeah. They are having this. Of course, secondary schools, they are sexually active. So, some of us advocate for making those condoms available to these kids because they are already sexually active. In fact, most of the kids now, even in GHS, are already sexually active. So, either say, ube born no ban, ube man no condom no, mami, papa, ukoya for condom, protecting. At least condom no be preventing pregnancy, any HIV.
That's right.
But usually say you can't condom who wants now say some of our religious leaders know there's a bit of pushback, but the reality is that the kids are sexually active. In fact, me kai say me call GSS school be and I can't HIV once ye can't we no one young boy every time question be say anti a trace say oh you see 2 condoms at a time a bema no more protection than 1 condom. You see this question it highlights oh okay.
Last week we did contraception. Yes,
okay.
And we talked about even the proper ways of using condoms. Yeah, we talked about various ways of contraception.
Great. And if you look at this question from young boy with GSS, it means that the boy is sexually active.
That's right.
He's already active. When you akola ubekato and say, oh, abstain, he's not going to abstain or abstain. And we should make the condoms available. The condoms should be available to the youth because they're already sexually active. Start level, no, those in primary early GSS who are not active. You better educate you, you better guide you not to get into activity very early. But those who are already active, Master, you can't stop them. So the best is to make the condoms available to them so that they'll protect themselves. And the use of condoms now one very, very important way. And you're making sure so say you're living a responsible lifestyle because sebi anything in skirt bia opese only know that definitely you're exposing yourself. You expose now young lady only a mother anyhow she's exposing herself.
That's right.
And a trace you're practicing responsible sexual behavior. And after mother to child transmission so oba nimbia onko hospital na onko antenatal na intimate testing because testing wa ye bema withdraw obenuma ebe bo akola no ho ba ye ma bebre omo yare nu omunkola negative onkola no omunya yare nu they are fine. Because imagine innocent child na ya wonu na wanya HIV. Very sad. And we see them and most of them by the time akola no benya 7-8 years now wanya all kinds of infections. And the next thing is say omo use IV drugs no. Because say yetimi clamping down on IV drug user. You better reduce the transmission of yarenu. And it's one of the major means yarenu etimi spread. In some year count recently about gay ni lesbian no a very sensitive area and it mean call too much. But the idea is say so we are gay, we are lesbian, who they use condom. As of now, dear, you were lost. Ye Ghana, ye lost no, and allow Sanyamano. But we are use condom so that we bought very important because the statistics say infection are more common among the gays, far more common amongst gay men than in member or and there are reasons why. You see, if you go into it, you bet me actually with the reason why. But so say you understand it, and I say it. Send a yarenu a transmitter. You bet me a break is our means of transmission. And one is use of condom, very important. Mother to child transmission. No mothers no call ANC. And omo use IV drugs. And at home no so you avoid this. You be use sharp objects. Ebia obi you use ni shaving stick. Men ko use shaving stick. Ni bon shada nyedi. And now blade ebia. Obi neighbor in the same compound. Why you see blade actually in the nails and now bibisa, you get a new blade. Yes, exactly. Uko barbering shop say I think our barbers know they do very well. Obe say blade omudi channel omu you see the same blade for another person.
Oh yeah, omu discard.
Omu discard. The only thing is shaving machine no.
Also almost sterilizing.
Almost sterilizing the now sometimes ubeko machine be omeka to say oh this is a sterilizer. A blue light pedal omu too. Blue light. That is another problem, another area to be explored. Whether SARS sterilizers no. Whether indeed and the blue light pedal share some container so you see that's another issue.
Yeah, because I mean shaving machines is too sharp. It's sharp.
Exactly.
So I think also ye ni ko ho ho no mpa na ehwe because if say nka the papa m kra de anka be ma bia de nka wonya shaving machine o kwa na de ko te say de wan kasa wo I mean okay
exactly
nanka ho de ko near you because some of these transmissions no we be one crowd we need kwan of fast nyaye because now when you so we trace in maybe na barber shop bi okoye
barber shop very true.
So I mean that's it. I think say the time no so let's just talk about one thing bina yenko for the management they are hospital and once our hospital we have HIV clinics for one more
and in draw I want the public to understand say HIV in draw in draw no and 2 year there's no cure but you in draw yes, protect you so that you can live a normal life, and that's the whole idea. Well, the whole idea is HIV area not say living normal life, body defense no is intact. There's no problem, and that in draw there will be no sign say to the extent that ubetimi anya partner. Partner no onya yare yes
yeah
because say suppressive virus no to a very low level say oya oba say ya obetimi anya nkola omunya yare no say oya obema say possible say viral load no call undetectable levels the risk say obe transmit yare no to the sexual partner very very low.
That's right.
And we just want to confirm NTS say in Joe hospital say u feel say u so te unya fever bi umuye she unti ase untimi didi ye un say rash bi agbegu una munti ase and I say lymph nodes no
Children, to maybe a show
exactly
groin area
only na ha un say sanyama no eba a test I suspect said there's something going on wrong. A test Uba hospital 90 meters too. Yes, a test there are drugs available.
That's right. And Dr. Dekpeh obtaining came. Dr. Nabil Dekpeh, or fellow-in-training, or confanoche, physician specialist in cardiology. Yes, you know, you do as a person, Oje Bre, na. Your tones are one put in out or buy or they name they say I bray a T4. Now, I was saying my T4 so as I say, program ye medical matters Jumedian. The first Sunday of every month. Next, a question that be I did Busumi in kind. Any question that be a car Busumi in the trono. Any the medical matters a bray a T4 until was so motion and so. Yami Adoma Sunday a car Busumi in the trono, yes, Sabeba. Medical matters. Yeah, another interesting topic is abana yaka ho asem nti omonje bre no munti yete say the dada omoye no nti yeda yete fo asesa the pa Dr. Apacho last words for yete fo last words.
Yeah, okay, well me last words ni say well first just me massive for the platform Mojamaye and we want people to understand say in Ghana no every day there are 50 people enya HIV yarenu. Every day in Kofu 50 enya yarenu as new infections. Every day there are enti etrese yetimi bo yehuban. Etrese yetimi bo yehuban from irresponsible sexual behavior. Young men and women are omuye sexually active. Mu use condoms na muntimi and protecting mo. Very very important. And yarenu so a draw uba hospital. You be married, draw, you be protect you, and you live a normal life.
You was a doctor. You was a. Inti, you take for. You must say. You for more Facebook, me, YouTube. So you must say, "Moje bra, mohe." You bra no, I be. Inti, yesade. Assafuah radio programs no better also. You must say, bye bye.
Pomodi hu hia pa wo nipa dada setena mu onipa kra aduane die mu te sen wonno mu te sen frama a wo home nso enu nti nam se jebre na tie Assafuah 92.7 ebra Dr. Anthony Assafuah ne na pamfo nimdifo the medical matters brewo jumedie ye de brewo kwasia da bia edi kan ne da etwato e wo bosomi biara mu no 9 kosi no Assafuah 92.7.
You would be running away from me, cause I'll be scared.
Please the Lord, please the Lord, please the Lord. Me did invite